Commissioner Conway, members of the task force, good afternoon. My name is Marx Varela, and I'm here on behalf of the Colorado Coalition for Parity. Multiple data sources estimate that over 1 million Coloradoans have a mental health or substance use disorder, and nearly half do not receive treatment services. It's been over 10 years since the Mental Health Parity and Addiction Equity Act, or MAPIA, was passed. It's been 7 years since the final rule on parity was enacted. The Affordable Care Act, which extended mental health and addiction parity to individuals receiving Medicaid coverage, was passed in 2010. Colorado has had parity laws on the books since 1997. Insurance companies have had plenty of time to review federal and state laws and come into compliance with them. Despite that, nationwide, they continue to be found out of compliance with the law, as the cases settled in Massachusetts just last week demonstrate. Insurance providers continue to reimburse behavioral health care providers at a lower rate for comparable services than medical surgical providers. They continue to burden patients with unreasonable prior authorization requirements, and they continue to distribute provider directories with outdated, incorrect information. Each of these examples on their own contribute to decreased access to behavioral health care. Collectively, they intersect in the epidemics of overdoses and suicides resulting in the public health crisis that we're experiencing today. Insurance providers know that it costs a significant amount of money to provide individuals with safe, effective, high-quality mental health and substance use disorder treatments. For the record, I'm talking about treatment services that are effective based on measurable outcomes that result in people achieving and maintaining recovery for the rest of their lives. In the system of care prior to MAPIA, individuals seeking care for mental health and substance use disorders were repeatedly taken advantage of by insurance companies that often refused to pay for treatment services, and by treatment providers who, regardless of who paid for their services, provided substandard care. Despite the passage of MAPIA, we continue to see insurance companies cut corners to limit spending on life-saving mental health and substance use disorder services. When an individual or a family finds themselves in a hospital emergency room or a detoxification program seeking help, the last thing they're thinking about is insurance coverage. And yet, it's at that exact moment of vulnerability that gets exploited time and time again. And avoidance of that vulnerability is what prevents many people from ever even accessing services. It has recently been brought to the Coalition's attention that there is likely a fundamental flaw in the payment structure of services delivered through the state's Medicaid program, which places the state out of compliance with the parity requirements of the Affordable Care Act. This flaw makes it impossible for the state to conduct an adequate parity analysis between behavioral health services provided and medical surgical services provided. This issue urgently needs to be addressed. Surely we can do better. Over 1 million Coloradoans and their families, your neighbors, your coworkers, your friend, your husband, your child. Surely we can do better for all of them. Thank you.
Thank you very much, ma'am. I think I saw you give Kara a hug when you came in, so you know each other, and
Yes,
she's leading up our charge, so
Yes, she
we're on
is.
top of it.
And we're delighted that she's doing that.
Good. Thank you very much.